Welcome to the National Organization for Rare Disorders membership webinar on engaging Latino rare disease communities. Lessons learned from NORD's Latinos and Rare program. My name is Debbie Drill, and I'm NORD's Senior Director of Membership and your facilitator for this meeting. I would like to thank everyone for joining us today. All lines are muted and everyone's off camera except for our speakers, and our Spanish translators are obviously unmuted. We are pleased to bring you the voice of rare disease organizational leaders and subject matter experts. We have been doing this work in diversity, equity, and inclusion, and because DEI is so critical in the rare disease community, we have made this webinar open and accessible to the community at large beyond our NORD member organizations. We hope that it inspires all nonprofit leaders to expand their work in DEI. As I have said before, this webinar is being recorded and will be made available after we conclude. This is our agenda. We will have announcements. Then I will talk a little bit about our program, and then we will have our panel discussion. And at the end, we will have Q&A, which you can use the Q&A button in the toolbar. I mentioned NORD's mission because it's important for everyone to know what NORD does. We work to improve the health and well-being of people with rare diseases, all people with rare diseases, driving advances in care, research, and policy. If you are a rare disease nonprofit organization and you're interested in learning more about membership, please reach out to us. The email is on the screen. We can put that in the chat. NORD's membership team is working for you. NORD's mission is your organization's mission. During this webinar, an issue raised or topic discussed may prompt you to think of a question does not get specifically addressed within the hour. Reach out anytime to our email, membership@rarediseases.org. Again, it's in the chat. NORD has received funding to support the creation of 2 patient registries on the I Am Rare platform. This is a major opportunity for nonprofit organizations with active patient populations, vibrant communities, to utilize NORD's help developing a study that will advance medical knowledge about your disease. There is still time to apply. The deadline is October 20th. We'll put a link. It's already in the chat. Patient registry opportunity. One more announcement is that NORD has a program that helps patients and caregivers get education. This is our rare disease education support. It offers the community an opportunity to participate in educational conferences and programs if they are rare disease related. So if you want to go to a conference, if you want to go to an event, and you will learn about rare diseases, NORD can provide support with your registration fee. We have limited assistance for travel to the conference and hotel. And if you are interested, you can call or email. The information is on the screen. We also have a link in the chat for more details. Membership is supporting our organizations. NORD is an umbrella. We serve 1,000 organizations, and our job is to support our members, of which there are 330. But beyond that, we want to help all rare disease nonprofits with diversity, equity, and inclusion. Your mission is to advance research, find cures, support your community. How do you find diverse communities, marginalized, underrepresented communities? How do you speak to people who you are currently not able to reach out to through your current channels? We developed a 3-part webinar series. The recordings are online. They're foundational. They teach about basic concepts in diversity, equity, and inclusion, as well as advanced concepts like diversifying your board of directors, inclusion in research and drug development. We have toolkits that were created as a result of these webinars, and they are available in English and in Spanish. We just put a link in the chat. Thank you, Alexandra. So during this webinar, we will follow the agenda you see on the screen with these panelists. They are our guests. They are experts. They have engaged in Latino communities in various ways. We will have, we just concluded our announcements, and so we will talk about our work in Latino engagement. If you have questions, please use the Q&A function on the Zoom toolbar. How do you ask a question? There's that Zoom browser. click Q&A. It's the bottom of your window in the meeting controls, and you can put your question in the box anonymously, or it will identify you. Please note that we will address questions at the end of the presentation in the panels. So before I introduce the panelists and we talk about their work, I would like to introduce myself and take a moment to set the stage and describe NORD's Latinos and Rare program. So just a little bit about me. I am a Mexican-American, Chicana. English is my native language. I speak Spanish at a conversational level. My sister was diagnosed with a rare disease that nearly killed her, pulmonary hypertension. I was her caregiver for more than a decade, and I have the honor of working for 14 years at the Pulmonary Hypertension Association. And I'm now blessed to be working at NORD, the largest nonprofit umbrella organization in the US, serving 30 million Americans. I'm the Senior Director of Membership, and I work with our 330 member organizations. So during COVID and Black Lives Matters, NORD heard from our members about their hopes to engage marginalized communities. NORD developed a program with lofty goals. We wanted to shorten the path of diagnosis for marginalized communities. We wanted to increase engagement with those underrepresented in rare diseases. And we knew that we could do this, but we had to learn about specific barriers that these communities face, barriers to rare disease education and barriers in accessing care and treatments. There are so many marginalized communities. We selected Latinos and created the Latinos and Rare program for a specific reason. Latinos are the second largest ethnic population in the US. As you can see, they are 60.5 million Americans and the fastest growing population. Of this millions of Latinos in the United States, about 1 in 3 do not speak English well or at all. What's more, wellness and illness are experienced very differently by Latinos in the United States. They have a unique lens of religion, language, culture, immigration, family, gender or machismo, social economic experiences. Given these factors, NORD made the decision to conduct our first listening session series with the rare Hispanic and Latinx or Latino American community as a pilot to develop more engagement programs in other communities. How do we do this? To develop these strategies and best practices, we needed to try them out. And we needed to, before trying them, we had to figure out what we were going to do. And that required pausing, learning, listening, and engaging with those who already communicate with, participate, and are part of the cultura of Latinos living with rare diseases. So we did that. We identified community partners. They were both in rare disease Latino engagement and just community level Latino engagement in health. We wanted to learn how to build a listening session and how to bring community together to understand the barriers that they experience. We wanted to learn about language and immigration status, insurance, and other cultural barriers. And so we conducted expert interviews. We learned how to reach communities. We learned strategies, not fully. This is constantly evolving as the community and culture evolves. We wanted to learn how to engage and create a safe environment. And we learned a lot. We identified strategies and methods that will evolve as the community evolves. And we are so grateful for those almost 60 patients and caregivers who came together across 3 cities and virtually, who taught us so much about their experiences. We will be sharing our findings at NORD's Rare Disease Summit in 10 days, and we will publish a paper of findings later this year. We want to thank Latinos living with rare diseases and their families for their time and vulnerable sharing during these listening sessions. Now we have finally our panelists. I'm going to introduce our panelists. We're going to ask one question at a time, and then we will go into a more robust Q&A mode. So first, Gioconda Allia works with the medical affairs team at NORD. She graduated as a medical doctor in Brazil and specialized in medical genetics. She's worked as a medical geneticist in the clinical and academic field. And in the US, she worked at the Genetic and Rare Disease Information Center for 11 years at NIH, so NIH Guard. She started working at NORD about a year ago, and she's our ontology specialist. Gioconda is very passionate about expanding resources for Spanish-speaking patients. Rigo Garcia is the executive director of the Hemophilia Foundation of Southern California. Rigo has over 18 years experience in health education, leadership, and outreach, and a commitment to ensuring marginalized groups are provided primary care access. And prior to working at the Hemophilia Foundation of Southern California, he was the director of health education for the Venice Family Clinic, an organization that provides quality primary health care to people in need. Rigo created and managed one of the largest community clinic food distribution programs in Los Angeles. And he developed the Venice Family Clinic first ever doula service program. Dr. Claudia Soler Alfonso is a clinician and researcher in medical genetics at Baylor College of Medicine. She's assistant professor at Texas Children's Hospital, and she utilizes cutting-edge genetic testing to diagnose an assortment of genetic disorders. Her clinical expertise includes inborn errors in metabolism, chromosomal, and single gene disorders. And Blake Vuokolo is a research genetic counselor at Baylor College of Medicine. And Blake works on 2 research projects improving access to genetic testing in underserved and underrepresented populations with rare diseases in Texas. And Blake will talk a little bit about her work with the Latino community with Project Give, which reduces the time to genetic diagnosis for children with rare diseases in the Rio Grande Valley through telehealth and whole genome sequencing. So as you can see, we have an incredible panel here. And I'm very excited to ask the first question for Gioconda. Gioconda, I just talked a little bit about the Latino listening session, but you were there. You facilitated many sessions, multiple sessions in Espanol. What do you think created an environment that enabled sharing?
Yes. Well, as you said, as David said, the goal of the listening sessions was to engage Latinos affected with rare diseases and to identify the main barriers that they face. Being able to have the sessions in Spanish was really helpful, as the language is a big barrier for many. However, I think that the most important step we can take to create a sharing environment is to learn how to listen. Actively listening to patients delivers respect for their knowledge and builds the trust. To really actively listen and to try to understand all the stories that are being told to us, and with that, develop an empathy with the patient, with the participant in the session, which in the end results in trust and in honest sharing. So, listening.
Sorry. What did you learn from the participants? Anything you can share without identifying specific stories?
Yes, this is very interesting for me because since I was in medical school, I always believed that the patients can teach more to us than any book because it is an experience of the life that we are listening to, and this is invaluable. The participants in the session taught me a lot, and to all of us, because they could overcome challenges that for me and for all of us seem impossible. And they did that with all their dedication, the perseverance that they have. Even also when even for me, when knowing about the specific diseases, listening to the participants, I also learned more about the disease evolution and how this disease affected their lives in a unique way. It taught me also about their needs, not just of a treatment or a cure, but for other resources that could improve their lives. After the listening sessions, we remained in contact with the participants, and this was also very important for us because that way we could see how can we help them, and also what are the needs that they have. For me, being there was a privilege, to be honest.
Mm-hmm. And was there anything that was surprising to you that you didn't expect, or something that you learned that was new?
Yes, some of the patients that were there, it's not that I didn't expect, because it's very common for Latinos to have the whole family with us. But I will say it's always impressive. Like this one family who was the mother, the father, the son, and all of them participating in the session. And we listened to what they had done, and they all knew the details of the disease that affected one of the members of the family. So it's always impressive to see that.
Mm-hmm. Yeah, for some Latino families, when it affects one person, it affects everybody.
The whole family, yes.
Mm-hmm.
And they were there to show it.
Mm-hmm. Would you do anything differently for the listening session in terms of being a facilitator?
We can always learn more. I think being there and listen is what we have to learn more. How to actively listen to the patients, how to make them feel comfortable when they are talking, how to let them know how we respect their knowledge is very important, because they do know much more than we do.
Mm-hmm. Yeah. And I will say, Gioconda, having a medical background, did you find that being both Spanish proficient, Spanish speaking, and having the medical background were both necessary for facilitation? Did you answer medical questions, or how did you handle that?
For me, yes, this is important too. I think it's good to know, to have a knowledge of the diseases that they have. That makes them feel better, because they know that they are talking with someone who have a knowledge of the disease. And of course, knowing Spanish is a plus. It's always good to talk in your language.
Mm-hmm. Yeah, thank you. We did the listening sessions concurrently in separate rooms, and we had English for those who chose to speak English and were more comfortable. And then we had the Spanish sessions, and the Spanish were more popular with our community of participants. And Gioconda did an excellent job staying in touch after the session with the patients and caregivers. Thank you, Gioconda.
Thank you.
So next, I would like to ask Dr. Soler. You provide genetic counseling services to Latino patients. What is your experience and I guess practical advice on the cultural barriers or cultural considerations to access to genetic testing?
Hi, David. Yes, thank you for the invitation, and I'm very excited to see more of these spaces being created for this type of conversation. So happy to share this experience and hear more questions later. As a medical genetics practitioner and Spanish-speaking doctor at the largest pediatric hospital in the nation, here at Texas Children's, I interact a lot with many Latinos from all different backgrounds. And as we all know, putting words that will fit them all is impossible. And it really talks about the diversity we have that makes us so unique and beautiful at the same time. I think it's very important for all kinds of providers to be proficient in with some of these cultural differences that will really help us navigating into getting the families to make very good informed decisions about their care. And genetic testing is one in which these type of things need to be really taken in consideration. Obviously, the main problem is always the language barrier. And it's not just so much about translating, but the interpretation of the concepts. And we struggle sometimes on trying to put the concepts into the exact translation, but then we had to help interpreting and putting things into context so families can really grasp the idea what we're trying to transmit, so they can really understand the concepts behind the motivation for a genetic test and recommendation. The cultural beliefs are really something very important. I think Latinos, we all have very strong beliefs about health, and those have to do with spiritual beliefs as well. Many families may not be interested at all in understanding why they have a genetic condition, but they may be more interested on how to treat or what to do on a daily basis. So understanding the concept of the spirituality in relation to the disease is very important for us to have that communication. Many times genetic testing can guide diagnosis, and of course, it's one of the reasons why we will offer genetic testing is to really understand the clinical picture and really guide them to the best treatment options. Other things that are frequently encountered is a stigma. People don't want to be labeled to have an X or Y genetic condition. And this is not so, it's something that comes in consideration, but it's not so strong. Most families really want to know what's going on, but there is a hint of a stigma that needs to be addressed and taken in consideration with the family so they can really come up and really decide if they want to get genetic testing or not. And I think earlier someone mentioned about family dynamics, and it is obviously the concept of autonomy when we're deciding to have a genetic test. And most times they want to go home and talk it all over about with everyone in the family and make a conformed decision. So we had to work with that and get those opportunities, sometimes get someone else on the phone and make sure that the right spaces are created. And this also addresses one last thing that I want to mention, and is the distrust in the medical system. Most of us from where we come from, and many of the countries where we arrive from, they haven't really created that sense of trust. And we've been sort of like put on the side with many medical problems. So creating that opportunity and really creating a good partnership between providers, hospitals, and the families is something that comes with time, but it's also something that can be a significant barrier when we're accessing genetic testing and genetic services.
Thank you for that. We do have a question in the Q&A. Someone is curious. It's the largest, you work at the largest children's hospital in the US. Do you know the percentage of Spanish-speaking patients that receive care, the proportion that are Hispanohablantes?
I don't know the specific number, but I will say at least between 40 or 60% of my practice. The people that I see by nature obviously get routed more to my clinic. As the clinic, there's probably around 30% or less, or 30 or 40%. So it's a good proportion. And as mentioned earlier, one or two of those families, the majority don't speak English. So it's very hard to navigate the system for many of them.
Thank you. That's helpful. That sounds like a lot of the population that you serve. And Texas is so diverse too, so that's not surprising.
That's true. Yeah.
Speaking of Texas, Blake, thank you so much for joining us. You serve the Rio Grande area, which 90% of the Rio Grande area that you serve is Latino. Can you talk a little bit about Project Give and what the learning curve was to give whole genome sequencing for free to pediatric patients in that area?
Sure, Debbie. Thanks for having me today. So Project Give, as Debbie had mentioned before, is a research study that we started at Baylor College of Medicine. And the goal really is to reduce the time to diagnosis for children with undiagnosed rare diseases in the Rio Grande Valley. And this is the region of the Texas-Mexico border at the bottom of Texas. So we do this by offering virtual genetics evaluations through a platform called Consultagene, which is a telemedicine platform designed at Baylor College of Medicine that has some educational components and then also a telemedicine video conference. And then we also offer whole genome sequencing free of charge to our families that's covered by our grant funding. So as Debbie mentioned, 90% of the residents in Rio Grande Valley have or identify as Hispanic or Latino. And on top of that, a third don't have any form of health insurance. 40% of children are known to be living in poverty, and all 4 of the counties within this region are considered medically underserved by the HRSA definition. And so it's a really socioeconomically disadvantaged population as well, which we also know is underrepresented in genomics studies. And so when we think about access to genetics in this region, we know that it's also very limited. There's currently no full-time genetics provider in the region, and there's 1.4 million people who live there. And so we really felt it was crucial to design a project and offer much needed genetic services to children in the region. And to answer your question, Debbie, about whole genome sequencing, we decided to do this large-scale comprehensive testing because we knew that there were barriers for these families to accessing genetics care to begin with. And so we felt that this was our best chance at finding a diagnosis for these children without having to have multiple appointments for the families. So there are several ways that we really had to think about how to engage with this population because both myself and the principal investigator, Seema Lalani, live in Houston. And so we're not native to the region in the Valley. And so we really needed to think about how to engage with this population. As our project is really focused on having providers refer to our study, refer patients to our study, it was important for us to not only engage with the Latino families in the community, but also with the providers. And when we first started to work in this community, we found that providers did have some hesitancy with our study, and we needed to build their trust because in the past they had seen other services come and go for their patients, and they wanted to make sure that we were consistent with providing care and didn't just leave when our funding ended. And so really for us, what we found to be super helpful in terms of building these relationships with providers to get referrals is to actually visit the region and meet these providers in person to talk about our study, share information about genetics, and talk about ways that we could see this being sustainable in the future. And so that's something that's helped us engage with the community. And then again, being that we're in Houston and Spanish is not our primary language. In order to build trust with the families in this community, we needed to find someone in the region who knew about the culture of the region and who spoke Spanish as well. And so our lovely research coordinator, Roberta Sierra, is bilingual, and she grew up in the Valley. So she knows about the culture. She knows about the barriers that these families face. And being a social worker, she really goes above and beyond in helping families not only navigate our Project Give process, but also helping them getting services that they need for their children. And so families have really built a lot of trust in our team, and they're very comfortable with coming to us about their medical problems and also other social problems that they're experiencing with their families. So, you know, on top of the barriers to language that we have, we've also seen that there are these socioeconomic barriers. And we have really adapted the design of our study to make sure that families can participate even if they have transportation barriers or difficulties scheduling. And so those are some challenges we've had, but we've worked really hard to try to overcome them. And overall, it's been extremely rewarding to do this work. And our families are very receptive to receiving this information and eager to finding out more about their children's health.
That's an incredible program. And thank you so much for your work. As you were sharing your work, there were a lot of questions related to how to get access to care. And I am very excited for us to dig a little more into your project and all of our engagement experiences with Latino communities. So panelists, we are going to get there. Last but not least, Rigo. Thank you so much for joining us and for your time and all that you've done in your role as the executive director of the Hemophilia Foundation of Southern California. I have learned and I'm really excited about Familia de Sangre. Can you tell a little bit about this conference and what it takes to bring hundreds of bleeding disorder patients together?
Yeah, absolutely. Thank you and welcome. And thank you everyone for having me. We're really excited. You know, we do host Familia de Sangre. The Familia de Sangre conference is the largest bleeding disorders conference held completely in Spanish. This is a California statewide event that's held together in partnership with the three other hemophilia, or I should say bleeding disorders foundations in California, which include Central California Hemophilia Foundation, the Hemophilia Association of San Diego County, the Hemophilia Foundation of Northern California, and ourselves. And one of the greatest things about the conference is that the conference it's a weekend long conference from Friday to Saturday, which includes many education sessions, includes entertainment because we're Latinos and we like to have a party. And it includes an exhibit hall. And I think one thing, even with our exhibit hall, that makes a difference is that every exhibitor has a Spanish speaking person at their booth, which, language does not become a barrier attending the Familia de Sangre conference.
When you came in, I know you've been in the role for a couple of years. What do you think is, how do people come together? Like, how do you bring them? They're not all coming. Are they all coming from California?
No, our conference has really grown. The first year that we had it, we had around 300, less than 300 community members that attended. This last year, which was our 7th annual, we had over 700 community members that came together. And it's not only California, it included, I think, 8 or 9 different states, Oregon, Nevada, Arizona, Texas, Colorado, Chicago area, New York area, Florida, Puerto Rico, and then we had 2 families that came from Mexico. So our conference has really grown. And one of the things that I think that makes the conference so successful is that we are, with rare diseases, we knew that many years ago, rare disease was a death sentence, and life expectancy was not one that was expected to grow old, But one of the things that we've noticed, especially with change in medication, and a lot of the work that my fellow panelists are doing, we're able to learn, and we see that life expectancy is, what you consider regular life expectancy. And with that, I always say, come the chronic diseases must be Latinos, because they never come one at a time. It's you're invited to a party and they bring, everybody and their mother to the party. And that's one of the things with chronic diseases. Many people who have a rare disease are now having diabetes, and with diabetes comes hypertension. With hypertension comes other problems. And one of the things with our conference that we really want to do is that it's not a conference just to check off a box. It's not a conference just to, hey, we're doing this for the Latino community and then we're done. It's one of those things that we are bringing topics that are important to the Latino community. As we said, as one of my panelists said, the whole family is affected by the disease. And when we think about that, a lot of times parents will put their children first. And so they'll focus on the child's disease, not taking care of their own. And when we have the opportunity to bring them together, we need to make sure that we're providing whole family care. And that's one of the things that the conference entails. We're not just focusing on chronic diseases or bleeding disorders, but we also focus on, we had some classes on nutrition, we had a cooking demonstration, we had financial education, advocacy, how to tell your story, and how does that become the elevator pitch? So you can tell it at your school, or you can tell it to your local government, or be able to go to DC and tell your story. So many times we think of advocacy and we just think of the government aspect, but sometimes you need to advocate for family members who don't understand what this is. And they might say, oh, you have a bleeding disorder, give them more iron. Their blood is weak, and we hear this with every rare disease. So how do you make sure that your own family understands what we're doing? And I think that's one of the things that we really bring that puts our conference aside, different from other conferences. And the whole conference is completely in Spanish. We do have English interpreters. And so, that is one of the things that we bring. But we, as someone else also mentioned, when we have interpreters, that's what they're doing. They're interpreting what we're saying. They're not translating what we're saying. And that's a major difference, because many times, and we've made an effort now to talk much slower, but we know that we're Latinos and we start talking really quick and we start talking with the hands, and when the interpreter is trying to catch up to that, it be in English or it be in Spanish, a lot of words are missed, and we know that when they have the headsets on and the whole room is laughing. And then if it's a Latino, they're looking around, they're like, oh, I should laugh too, because they don't want to feel out of place. And that's one of the things that when we had our Spanish conference, we had one of my board members who put on their ear set, and they're like, I missed a lot of things. There was jokes that I missed, but I looked around and I just laughed because I didn't want to feel out of place. And I think so many times the Latino population feels out of place when they go to a conference, when they go to a clinical trial, or whatever that we do.
You just shared a lot of really good, insightful tips on how engagement needs to be not on the side, that it needs to be direct conference in Spanish, not like a side where there's translations, that interpretation and translation isn't enough for full inclusion. And doing that is a great first step. But it really, the reason why this conference is so successful and so large is because it's Latino centric and it's Spanish first and the English is translated after. I think that's incredibly interesting, because this webinar is for nonprofit organizations to learn how to engage. And, having the largest conference for Latinos with rare diseases in the US, adding that family component, bringing in nutrition, thinking beyond rare to bring the community, because it's not just a conference for patients, it's for the entire family.
Right. And that's one of the things that we have, like a teen component, we have childcare, because these are things that we have to think of as well. So many times, again, we'll have a conference or we'll have a get together, but we forget, Latinos, we're going to bring our children, we're not going to leave them behind. We're not going to leave them with someone else. But how can I 100% put my attention to something if I have my child crying, or if it's a 7 p.m. meeting and they're tired? So these are little things that we need to think of when we're thinking of whole person, or even, and whole person is very synonymous with Latinos, in that sense, that we need to make sure that we're not just checking a box, but we're providing family education.
Yeah, that's really helpful to hear. And I think for a nonprofit organization looking to move into this area of engagement, that family component is really important. There was a question in the Q&A that I want to bring up, and a lot of the questions in the Q&A are related to access to care. From an organizational perspective, nonprofits are working on how to help support access. But the question was relating to spirituality, that Dr. Soler Alfonso mentioned, spirituality and health. And I wonder, Rigo, if spirituality was something that your organization talks about as it relates to living with a rare disease.
Not necessarily. We don't talk about it in the forefront. It is one of those things, though, that I think understanding spirituality, understanding religion is important, especially with Latinos. So, if a family does tell me, can you pray with me? Absolutely. I'm the cross, may God bless you, or whatnot, you have to keep that in mind and thank them and kind of go with the flow with that. It doesn't have to mean that you believe in it. It doesn't have to mean that you don't believe in it, but you cannot exclude that component, especially with Latinos, where religion is a big part of their everyday life.
Thank you. And then Dr. Soler Alfonso, could you expand a little bit more specifically when you engage with families? How do you bridge that spirituality and health cultural consideration?
First and most, to be aware, right? That is a central part of many of the families' majority of the Spanish-speaking families we interact with, and just simply ask, how do you feel from the spiritual side on this? Am I making sure that this is in congruence? Are you comfortable talking about this? And I mean, most families are, and they're going to start talking about it and letting you know what are their expectations, and then you can really customize the language and try to bring it in a way that is going to meet them in the middle with that. So it's important to acknowledge it. For some families, it's not that relevant at that moment in the clinical space, but just being aware that there's a need that need to be checked on will be very important. Don't let it go. We as Latinos also use religious ways in many ways to show politeness, and I noticed that as well. I think that's what Rigo, and I will agree with you, that simply say, you know, when they're telling you God bless you for your work, or thank you for helping in a religious manner. They're not trying to impose your religious beliefs or your views on you, but it's a way that we express our gratefulness, and we're really expressing politeness. So all those things are things that are cultural and spiritual, that they intertwine. And for people that are not that familiar with the culture, that can be something that may be looking odd, or, you know, out of place, but that's all what it is. So it's important just to acknowledge it and address it.
Thank you for that. I hope that answered the question for our audience member. For Dr. Soler and for Blake, in the work that you do you ever collaborate with patient organizations when you engage Latinos?
Yes. So I work closely in the U.S. and outside the U.S. With family organizations, and I think this is really a way that needs to continue working, expanding, and really growing as we progress more with the interconnectedness that we have now with the internet and Zoom meetings and everything else. For the last 2 or 3 years, I've been working closely with the Tango 2 Foundation, which is a US-based organization that deals with patients with Tango 2 disorder. Tango 2 is a fairly new disease, actually found by also Dr. Sima Lalani here at Baylor maybe 5 or 6 years ago. And at the time, there were very few patients, and this foundation really grew to expand to the point that we now are aware of almost 100 families with Tango 2. And something that had really happened with this foundation is that through partnering with the researchers, we have a very good natural history study, and we've been learning a lot about this condition in the last couple of years. 2 main things that we learned that I think are a great example of the power of partnering family organizations with physicians and researchers are the fact that this condition may be as easy to treat as using vitamin supplementation. And this condition affects the heart significantly to the point of being life-threatening, and it looks like vitamin B supplementation may be life-saving for these patients or some of these patients. So simple treatments that can be added to rare diseases, and they can really impact their natural history. And the second that I think is very relevant to our topic today is that it looks like this disease may be more prevalent on families of Mexican descent or families of Mexican ancestry. So the more families we organize and we learn about them and their genetics, we were able to understand that maybe 1 in 600 individuals of Mexican ancestry may be a carrier for this disease. So it's very likely that there may be a lot of cases either in Mexico or the Texas Valley or all the areas related to the border of the US that may be having children with this condition that may have gone unrecognized and may be passing away without a diagnosis. So with this organization, and we had really partnered to bring all this information in Spanish in the form of webinars, partnering with the Pediatrics Association in Mexico to continue raising awareness of this disease. So our goal is to continue to find more patients, obviously, and to continue learn on the go as we find more individuals with Tango 2. Outside of the US, I also work really close with the Glycogen Stress Disease Foundation in my home country in Colombia. And I serve as a medical advisor for all these years, and we also organize a pro bono clinic and a conference. So translation of knowledge is also very important, not only not only the fact of getting together, but also being able to bring the experience, not only of what we can find in a quick YouTube video, but treating these patients day by day and being able to transfer that to local providers, not only in Latin America, but in other areas here in the US that are separated from the main metropolitan areas is actually very important. And that also had created opportunities for us to come and observe what we may be different from what we know about these diseases. Like, for example, with glycogen storage diseases, we think that maybe type 1A, which is one of the many types of GSD, may be more prevalent in between Latin Americans, mostly because there is a Mexican mutation. But some of my observations there is that potentially type 3 GSD may be more common in between Latinos. And we're about to publish a manuscript showing 8 different new novel pathogenic variants in these genes that seem to be more unique to the Latino people. So these are some of the examples of how these spaces really allows us, researchers and also families, to come together and really expand the knowledge at the same time where we're providing the experience and really enhancing their care as we go by. But this is just 2 of the examples of some of the family organizations and how powerful that partnership can be as we progress and find more patients together.
That's really incredible. Thank you for sharing that. So we encourage all of our members in rare disease nonprofit organizations to reach out to clinics and talk about collaboration, because there's so much that these rare disease clinics and medical community can learn and in this partnership. So Blake, the same question to you. How do you work with organizations?
Yeah, that's a great question. So in our study, I haven't had direct experience working with any patient organizations. I will say, just from my experiences with this population, it seems like there are very limited resources for families in this region to participate in things like rare disease organizations. We've asked several of our participants if they're aware of any support groups or anything in Rio Grande Valley, and the families aren't familiar, and our collaborators aren't familiar with anything like that in the area. We have identified some patients with extremely rare conditions, like conditions where only 25 people have been described. And so there really aren't organizations that we can connect them with at this point. And we're also finding challenges with connecting families to existing support groups because they don't have Spanish support group options and their resources aren't in Spanish. And so my experience has been a little limited because of some of the barriers we have with working with Spanish preferring participants in an underserved region. And so our team has explored options to potentially start some sort of support group or look for ways to help connect families with other individuals with their condition. But that's still stuff in early phases of development with my team. What I have seen that's been very interesting is some of our families are very technologically savvy and have actually used TikTok to connect with families across the country. And so that has been a very effective way in helping them find support that we haven't been able to give them in traditional senses.
Thank you for that. We have so many questions about accessing through telehealth and language interpretation, and we have 20 minutes left. Technically, this webinar continues a little bit after the hour, but I do want to say to those who are asking those specific clinical access questions, we may in 2024, because of this interest, explore talking about this specifically. It's a whole other webinar. It's a whole other conversation about that access from an organizational perspective as nonprofit organizations serving. We have a couple of questions that I think are really helpful and are questions that we have heard from NORD's membership team, which is the struggle of getting the word out. So nonprofit organizations have education, and they may interpret those resources, they may interpret the programs, they may have Spanish resources available. And one question Querent asked, they haven't built trust with their social media platform, and they wonder, is Facebook the best way to share information with Spanish-speaking families? How do they engage the community? Because they don't have the resources to do local. They don't have chapters. They're not everywhere. They just have a national presence and they have social media. So with a low budget and with social media, is there an opportunity there, you think, to reach Latino communities?
There is in regards with Facebook. I think Facebook, a lot of Latinos will use Facebook as opposed to any other real social media platform. I think it's just because it's easier for many to use, and because a lot of the younger children have gone out of Facebook, so they, their parents won't see a lot of what's going on, and we've heard that with a lot of the teens. But I think one of the things, when you have a low budget, and you want to get the word out, one thing that we cannot forget, being a national organization or being a hospital setting or whatnot, is that you have to remember that many Latinos go to community clinics, and community clinics has been my background for 20 years. And there are so many community clinics out there where they are your elementary school of healthcare within the community, especially the Latino community, or people of color, if we want to kind of expand it beyond Latinos. And one of the things about that is that be able to use them as an insight. Use your public health system that's out there to get a lot of your word out, and they'd be willing to do it. They'd be willing to. I will say though, you will need to take a bit of time to create that relationship, and it doesn't mean going out to lunch or anything like that. But don't go to them the moment you need them. Don't go out to them, hey, I need you to put this out. But hey, this is Rigo. I work for the Hemophilia Foundation of Southern California. Just want to let you know that we have a lot of programs for people with rare diseases. Want to handouts? Do you mind sharing it with your community? Everyone has newsletters. Everyone has newsletters they want to fill. And you can just get the word of who you are. Once they know who you are and you have that connection, I think it's a lot easier to get the word out beyond just Facebook, but using your local public health connection, and we forget that there are these community clinics, and community clinics are very well connected, because they have clinic associations, they have state associations, they have county associations. So to get the word out can be very useful in that aspect as well.
That's excellent advice. And it makes sense considering your background, knowing that this is an opportunity in an area, I think it's underutilized. And it's also maybe a little overwhelming because Latinos are the second largest ethnic population in the US. How does an organization that has maybe no full-time staff, or maybe one full-time staff, the executive director, how do they start if they want to go into a community? What would your suggestion be, if anything, to go into one grassroots or into multiple communities?
You need to be willing to partner, and a lot of times we forget about that. We think, well, if I do something for them, if they do something for me, I have to do something for them. And many organizations, especially nonprofits, we don't think that way. If there's a way where we can partner in any sense of the word to get the word out, or to you are a staff of 3 and none of you speak Spanish, and you need to get a Spanish group going. What is your Spanish organization that's around you? Is it a community clinic? Is it a clinic is it an organization like ours? It doesn't have to be directly related to what you're doing, but can someone help you out? Is there a group that's willing to get the word out for you, or even help you out? There was an organization, it's not bleeding disorders. They sent me something. They're like, hey, I saw you in a conference. Can you help me out? I want to put this, I want to get my Latino community out there. Do you mind translating this into Spanish for my newsletter? It took me 10 minutes to be able to translate that, where if they were going to try to do or pay someone, it was going to be so much more. It's like, we need to be able to help each other out in those aspects, and we did that. And that was someone that I did. And when they had an event, because now I'm on their newsletter, I'm like, hey, can you share your agenda for this event? Because I want to be able to copy something like that for my people, but for my bleeding disorder, they're like, absolutely. And that's where it kind of starts to grow in that aspect where you have to, look at and be willing to share and see what are some of the things. And sometimes you have to think outside of the box beyond your condition, if that makes sense.
Mhm. Yeah.
And if I may add to that, Rigo, that one thing that sometimes I've seen happening is that people don't think that a simple pamphlet will make a big deal, right? And some of the work that we have done with Project Give is to make sure that there is enough information available, that it's just there. So when families walk around a community clinic or some of these small specialty practices, and they're there in the waiting room, this is going to be there, right? And that is a very, say, not too difficult way too, and also not too innovative, but you'll be surprised at how many calls we will get after that. And also, it's this thought that the community, or the Spanish-speaking community, is not going to understand what we're talking about, and that is not true. I mean, if information is presented like we will do, with respect, with good detail, and at a level that is understanding to anyone at least 5th or 6th grade level reading, I think that is important. And also it will create a space for you to address these other barriers that we discussed today. But just to think that they won't understand, or having that label right away that they won't understand, it's going to be the first barrier that you'll need to overcome. If that clinic doesn't open the door for you, go to the next, because that may not be the best place, right? So you really need to continue knocking on doors to get the right agents in the community to spread the word for you.
I agree. And Rigo, I really liked what you said about thinking outside of the box. And that's something that we had to do quite a bit when we were trying to increase our referral basis. And we were finding that providers like pediatricians and specialists that we thought would be our main referrers were just so overwhelmed in their clinics, and they weren't referring. And so we started to think, who else can we reach out to? And we said, well, I mean, speech therapists, physical therapists, they see these patients too all the time. They know, what genetics conditions can look like. And so we started reaching out to these types of therapy clinics, and they've become a really important part of our referrers, and, going to medical assistants and things like that. So I really, I appreciate your comment about thinking outside of the box, because, if you're trying to break ground in a place, especially that you have no connection to, you have to think broad. You have to think about all the people who are involved in the care of individuals with rare disease and how they may be able to help.
I think Blake said it really well, beyond just that, and she mentioned that the medical assistants, the registration clerks, these are the people that are talking to the patients the most. They're the ones that are asking, how's your son? How's your daughter? They're the ones that have a lot of that connection. And they are the ones that are going to be able to get a lot of the word out as well. So don't think physician or clinician, because they're very busy, as the clinicians on here know, but who are the rest of the staff that can assist with that, that are part of the same medical team.
I will also, I'm sorry, I was just going to say that by experience, one thing that also helps is reaching out to the churches where the population goes, as they will, for free, do the advertisement, so what is there for as a resource. So I agree completely with the community clinics, and I will add these other resources that are free for us to use.
Even the school nurses at the school district. Sharing the other day the story of two of my patients with this rare disorder, that they found each other through the school nurse, right? So all those agents in the community that are there, and they want to help. They really want to help, and you'll be surprised. I know many of the attendees have experienced that, but that is really how you start building that network to get the word out there.
Like you said, churches, schools, they have like a back to school event or fairs, and one of the biggest things that we have learned, especially after post-COVID, is that everybody wants a lot of in-person stuff, and everyone's doing these health fairs or these street fairs, whatever it may be, put a booth out there. That's one of the things that we've started doing, Here in Los Angeles, we have Placita Olvera, which is very popular, and we had a Cinco de Mayo event, and we went and put our information there. And when people were coming to our booth, they're like, what is this? And I'm like, oh, we just help people who have bleeding disorders. And sometimes they'd be like, well, I'm on this medication and my blood is thin, and I'm like, okay, well, that's not a bleeding disorder, but, it would be this. And those 2 seconds that you can take to educate someone, then they're like, well, my daughter is having issues with her menstrual cycle and bleeding more than seven days. Can that be something? And it's like, yes, that might be something, but sometimes areas that you don't even think that you might fit in are things that we did. We went back to Olvera Street, or Placita Olvera, right now for the Mexican independence, they had another event there. We had another booth there, again, just to get the word out and people to know who we are, so that, and then from there, I was just handing packets out to everybody that was there, from our local elected officials to hospitals to HealthNet, just so that people start to get to know who we are. And once you start doing that, and the community knows you, they'll feel more comfortable to do stuff with you. And I think one of the biggest things is that, especially with the Latino community, is that we don't want to be invited to the party, or just to the party, I should say. We want to be invited to the planning of the party. And that's one of the things that when we're thinking of clinical trials, when we're thinking about programming or whatnot, try to get the Latino voice or the Latino opinion as soon as possible, not when it's ready to go. And I know that there's a lot of legality that goes along with that, but make sure that you start to include them. And I think a lot of the pharmaceutical companies that are working on clinical trials, they're asking the Latino population, how do I get more people? Well, tell us about what's coming up. Don't invite us or tell us when you already have a product and you need us to try it, because at that point you've lost our interest and we're not going to trust it.
Incredible. Thank you so much for sharing all of these. I have so many notes, these insights. This webinar is being recorded and the recording will be shared. We have 5 minutes left. We still have a mighty group of 120 in the audience. We have dozens of questions in the Q&A that we won't have time to get to, some of them very specific to clinical access and telehealth. In the last 5 minutes, I'm not going to summarize what was shared, but maybe I'll summarize just a little bit. Language barriers are a huge area of work, and cultural beliefs include spiritual beliefs as well. The family dynamic is important to talk about and to address, as well as including the family when planning conferences, and that could be nutrition workshops. Partnering with clinics and working with community health clinics are important. One of the things, Rigo, that you shared, don't go to Latinos the moment you need them. The time for collaboration and partnership is relationship building. It was yesterday, let's try today, go local, go into the communities. There's so much that you shared. In the last 4 minutes, love to give each one of you 1 minute to close with anything that you wanted to share related to any aspect of engaging Latinos. I'm gonna put Gioconda on the spot.
Yes, I wanted to also comment about the Rare Diseases Center of Excellence. As you may know, NORD has designated 40 Rare Diseases Center of Excellence in the United States. With the network, we want to improve the access and the clinical care for all rare diseases patients, and also support the family needs, improve the quality of life, as many of them those have a cure or treatment, a specific treatment of the rare diseases. These centers, they have all the major specialties and medical teams with experience in diagnosis and treatment of a number of rare diseases, and also researchers actively working and finding new treatments. So NORD is interconnecting this network of centers, and it's encouraging the collaboration and sharing all the best practices and expertise among the centers. And this is also, in this center, we have several working groups. And in the working groups, one that is specific to what we are talking about is the diversity and inclusion. We, as an organization, we recognize the need to have more information in Spanish. We are developing more information on specific rare diseases and recognizing that we need to take more steps toward diversifying and including all people that are affected with rare diseases.
Thank you, Gioconda. Turning it over to Rigo for a last minute. Anything you want to share?
I think one of the biggest steps when we're talking about how to start including Latinos is the first and easiest step is make sure that all of your information is bilingual, both in English and Spanish. I think that would be one of the biggest things. And one of your starting points, once you have that, I feel that people will then be able to understand. And that goes with consent forms, that goes with, some of the questions, consenting materials, but know that Latinos do need to take that information home. Do not expect them to make a decision right then and there. They do need to talk to their family to be able to make a decision as a family as to what the next step of that person's care is going to be.
That's great. Thank you. Dr. Soler?
Yeah, I think those are really great points. And I think for those that are out there trying to start their own organization, we show some of the great progress you can make in partnering with doctors that have a special interest for the particular disease. And one important thing is that we also need resources. I think all these fundraising activities, even here getting together and just showing up to these conferences is so important, because these numbers are really telling the greater organizations that there is interest and there is energy into looking into Latino a little bit more, and that is very important. One example that I have for resources is the fact that many of us here are native speakers or proficient on speaking Spanish, but we really want to capture all the information as much as possible. So in some of the branches of Project GIVE, we have a lot of interviews in Spanish, but it's very hard for us to sit over and translate and interpret all the 30-minute interview length, right? So these are little resources that can really help us getting those voices into the scientific spaces, so we can continue moving that information and making it useful for all of us as a group. So those are some of the things. And the last thing I would like to address, someone was asking in the Q&A about starting when there is only 1 or 3 or 4 families, or only 1 or 4 families. And I want to tell you to continue going, do not lose motivation. This is very important. A lot of these families really started like that, with 1 or 3 families, and then they became what they are today. And the other thing is not to just concentrate in one group, or say many of these conditions actually belong to a greater group of conditions, right? So perhaps talking a little bit more in private, we can give you more guidance, but maybe that strategy of finding the specific genetic change for you may not be, you may not find 1 to 3 families, but if you develop an umbrella of conditions, you may find more families more efficiently. So don't get unmotivated that it's only a few. And again, find a doctor that has that interest. We would love to find the 1 to 3 families, because that's what geneticists live for. If we have more than 1 family, we really will get excited.
Thank you. And they can talk to membership at rarediseases.org for help in building coalitions or finding them. Thank you so much for that. Blake.
So I think just to start, I think it's always important to remind yourself that the parents of these children with rare diseases are really the experts in the condition. And so it's important to, as Gioconda was saying at the beginning, just listen to these families and make them the center of what you're trying to do. I wanted to touch on one of the points that I saw in the Q&A, and it goes back to what Rigo was saying earlier about how Latinos are being left out. And, there are instances, as I said, where there are very rare conditions and there's no Spanish materials. And so, one of the things that we prioritize in our study is creating those materials. So we actually draft letters for providers and patients about the diagnosis that we find, and we do translate that into Spanish, because at the end of the day, we want those parents to have something that they can take home with them, to share the information with loved ones who couldn't be on the call, and to give to their other providers as well. So, don't stop at thinking that we're improving access to care if we just give them genetic testing. We need to make sure that this information is digestible and that they can move forward and provide the best care for their families with the information.
Thank you so much. That is fantastic insight. And thank you to our entire panel for providing such amazing learnings from your work through genetic counseling and testing, and through your clinical care, through your work at GUARD, and through your work, Rigo, with your organization. Our presenters have graciously shared their email addresses. We have the Instagram account for one of the presenters, and we want to keep the door open for continued conversation and collaboration. This will be on our website on rarediseases.org/diversity, equity, and inclusion. So if you missed that, we will share the link with all of the registrants. We are just continuing to build the resources that we have here, and we will email you when the report of our Latinos and Rare program is finalized and disseminated. So thank you so much to our panelists. Thank you all, the almost 100 who stuck through the quarter hour after. And thank you for the questions. We will do our best to look at them and see how NORD as an organization can support you in continued engagement. So thank you so much, everyone, and have a great rest of your day.